Today, we are reporting an additional 1,429 cases of COVID-19, and our provincial weekly case incidence rate is 56.4 cases per 100,000 people. Ontario's percent test positivity has been steadily increasing and is currently at 6.6%. Hospitalizations have increased by 13% in the past week, and while ICU occupancy remains stable, the expected impact of Omicron on hospitalizations in ICU is not yet observed. While there is still some uncertainty around the virulence of Omicron, we have good evidence that it is more transmissible than the Delta variant, and it is spreading amongst fully vaccinated individuals. Data suggests that each Omicron case is infecting 4 to 8 times more individuals than the Delta variant, and it is rapidly becoming the dominant strain in Ontario. Les données suggestent que chaque cas de variant Omicron infecte 4 à 8 fois plus d'individus que le variant Delta et que Omicron est en passe de devenir très rapidement le variant dominant en Ontario. This means even if it is less severe with so many people infected, there may be significant demands on the healthcare system. This also means that we must take steps to protect our most vulnerable, including putting in place enhanced measures to limit the spread of COVID-19 and protect long-term care residents, staff, and caregivers. Notably, all general visitors will need to be fully vaccinated to enter a long-term care home, as well caregivers, unless they have a valid medical exemption or they are visiting residents in palliative end-of-life situations. We will also be requiring the testing of staff, students, volunteers, and caregivers, regardless of vaccination status, at least twice a week prior to entry into the home. A negative test will also be required upon entry to a long-term care home for all visitors and support workers who provide essential services to a resident or to the facility unless they have a negative test the day before. Additional restrictions with respect to the number of visitors per resident, as well as cohorting for high-risk activities, will also be implemented, and we are directing long-term care homes to increase infection and prevention control audits. To further protect retirement home residents and staff from the spread of COVID-19, the same testing strategy that I just outlined for our long-term care homes will also be applied to our retirement homes. Retirement homes should also be limiting the number of visitors and group sizes for social activities and events, and they must also increase their infection prevention and control audits. We are strongly encouraging retirement homes to restrict general visitors to only those that are fully vaccinated and implementing additional requirements for essential visitors and general visitors who are not fully vaccinated when entering a home. Strengthening public health measures in our long-term care homes and retirement homes is critical to protecting our most vulnerable from the Omicron variant and overall increased spread of COVID-19. Also critical in our fight against Omicron is vaccination. Ensuring that all eligible Ontarians are able to receive their vaccinations as quickly as possible is of the utmost importance to reduce the risks of morbidity and mortality from COVID-19 and maintain critical operations in our healthcare system. So I am once again making a call for arms. Il est de la plus haute importance que nous nous assurions que tous les Ontariens puissent recevoir leur vaccination aussi vite que possible afin de réduire les risques de morbidité et de mortalité dus à la COVID-19 et afin de maintenir les services essentiels de notre système de santé. Donc, une fois encore, j'appelle tout le monde à retrousser ses manches pour recevoir le vaccin. Although our vaccines appear to be less effective against transmission of Omicron, evidence is showing us that they still likely provide strong protection against severe illness, especially with a booster dose. That is why it's critically important for those who are eligible for a booster dose to come forward immediately, especially those who are elderly and immunocompromised. I would ask that all healthcare workers who are eligible to get their booster shot. This will not only help to protect you, but also the patients you care for. It is more urgent than ever to come forward and get protected. While many Ontarians are eligible for a third dose, we still need to make sure that our 5 to 11-year-olds get their first shot. 31.5% of our kids in this age group have already received their shot, and this is a tremendous achievement. I'm urging all parents and caregivers to please make an appointment and get your child vaccinated as soon as possible if you have not done so already. To quickly increase our vaccination rates over the next few weeks, all of our health system partners, including primary care, hospital sector, pharmacies, and our public health units, are prioritizing the administration of first, second, and booster doses as quickly as possible. Getting your COVID-19 shot is important, but we know that it isn't enough to prevent spread. It is essential that individuals continue to adhere to basic public health measures, including reducing your total number of contacts, wearing a well-fitted mask from nose to chin, washing your hands frequently, physical distancing, and staying home when ill, even with mild symptoms, and get tested if you have symptoms compatible with COVID-19. These actions, in combination with vaccination, can help to reduce the transmission of COVID-19 and its variants, protect public health and the health system capacity, and save lives. Ces dispositions, en association avec la vaccination, peuvent aider à réduire la transmission du COVID-19 et de ses variants, à protéger la santé publique et la capacité du système de santé et à sauver des vies. We need to keep each other safe. Thank you. Merci.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, Dr. Moore. I wanted to ask about the stricter isolation rules for vaccinated people who are exposed to Omicron. The London Public Health Unit, I believe, has said they're already just going to start treating every case as if it's Omicron, and those rules are going to apply to vaccinated people who are exposed. Is the province going to do that? And at what point are you just going to treat every case and every exposure as if it could be the Omicron variant?
Yeah, thank you for that question, Holly. And yes, we're seeing Omicron quickly become the dominant strain in Ontario. I think it's prudent and reasonable to treat every new case going forward as Omicron. We know that it spreads very, very quickly, so the isolation of high-risk contacts seems appropriate across Ontario at present. We are watching the modeling and the prediction of when Omicron becomes 100% of our samples. That is actually predicted before the end of this month. So I think it's prudent and reasonable to start that process.
Follow-up?
Yeah, just so I guess I make sure I understand what you're saying. Health units should be instructing people to be isolating as if they're exposed to Omicron starting today. And I'm wondering as well if there's a plan in that event to kind of deal with potentially having a lot of essential workers or healthcare workers isolating for a long time if they were exposed to COVID. Like, are you looking at alternatives to let them back to work sooner if they test negative in that situation?
Well, thank you for that question. You're anticipating our thoughts as well. We are very concerned about a shortage in health and human resources in the setting of Omicron, given its potential for rapid spread. So we have a strategy to bring workers back that have been high-risk contacts, and one of the strategies would be to have daily rapid antigen testing for those workers. If they get symptoms, they'd get a PCR test. If that's positive, they'd be off. But we may need to have a strategy of daily rapid antigen testing for high-risk healthcare worker contacts to keep the workforce in place that we need to best serve Ontarians.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Dr. Moore. I think some people watching this press conference had anticipated you'd actually be announcing some new measures beyond what was already reported about long-term care. You're not announcing anything about boosters, better access to rapid tests, ventilation. Why is that?
Well, first, this is about some of the precautionary measures we've already put in play to best protect our most vulnerable members of our community, so those in the long-term care sector and senior sector. I think that's been prudent and proactive. We have to learn from the last 20 months in the Long-Term Care Commission. I think we are taking proportionate response to protect them. The second major announcement today is we've built capacity. So all weekend we've been discussing with partners of how to increase the number of people that we can vaccinate in a very short period of time in Ontario. And I'm happy to say that just in a few days, we've gone from 37,000 on a weekend to 95,000 people vaccinated yesterday. And it's our intent to work with all of those partners to increase capacity and ensure that those over 50 as a prioritized population and those that are currently already eligible for their third doses get them. We think it's exceptionally important to get those third doses in those that would be the most vulnerable if they got Omicron to be admitted to hospital and get them best protected. So the current eligibility list did expand yesterday to 50 and over. We will do our best to rapidly increase capacity across Ontario to make sure that those are eligible get their appointment and get protected. If there is any capacity extra and we don't see people, we've built it and people don't come, we will open it up to other age groups and expand eligibility. But right now, to prioritize those that have the highest risk of getting admitted to hospital, it really is those that are immune suppressed, those that are cancer patients, transplant patients, those that are over 50 years of age. And a call again to those that are 70 or over who have been eligible for quite a time now to come forward. I think we're at 35% of those members of our community have taken us up on the third dose. It is more important than ever to get the third dose and get the protection that it offers against a new enemy, being Omicron. We will be responsive to the data. We'll be monitoring how many Ontarians come through and expanding eligibility based on our capacity. And it will be a very, data-driven response, and we will make sure that we vaccinate as many Ontarians as we can heading into the holidays.
Follow-up?
Thank you. I also wanted you to address the what we've heard from some school boards who have been asking kids to bring home their materials over the holidays in case there's a return to virtual learning. Can you address this? Is this something that the province is contemplating? Do you think it would potentially be a school board by school board decision? And what do you say to parents who are deeply disappointed that it has come to this yet again?
Well, it's my hope that we keep schools open as long as we can. You heard our medical officer of health mantra of first to open, last to close. We are reviewing every protocol that we have to make our schools even safer in the face of Omicron, and we'll be announcing some of those recommendations in the coming days to continue to keep our schools safe. I'm so happy that children, over 35% of the 5 to 11s have been immunized. Thank you to those families and those children that have come forward. We absolutely are still prioritizing children from 5 to 11 to get their first doses, and that strategy will continue for the coming weeks and months until we get very good protection in that age group. So that prioritization is maintained. We will be reviewing all of our protocols in the face of Omicron across all sectors of education, colleges and universities, and health system in response to this new enemy and making appropriate recommendations. But from a medical vantage point, I do believe they are safe and that they're safer than being out in the community, in a theater or in a mall, and that we've done tremendous work in Ontario to improve the ventilation, and I think we can do more in the face of Omicron to continue to keep them safe.
Next question.
Your next question comes from Anthony Fury with Postmedia. Please go ahead.
Hi there, Dr. Moore. You said a few minutes ago about if Omicron does prove to be less severe. We've just had more South African doctors going on the media, going on places like CNN, saying pretty adamantly that they think, yes, it is milder. We've got the EU CDC releasing a report today that says all cases in the EU for which there's available info and severity were either asymptomatic or mild. What are you thinking right now in relation to these reports and how they apply to Ontario?
Great question. We're watching that data come in as we speak, and we're in regular contact with the science table. I certainly hope that it is less severe, but we're planning for the worst, so equal to Delta. Hoping is not a strategy, and hence the measures we've already put in play to protect our long-term care sector, our retirement homes, our provision for increased accessibility of the third dose. We're taking nothing for granted with this rapidly spreading virus. The 700 cases today in Ontario or more, 750, we have one person that was admitted, and we don't believe the Omicron was the cause of the admission. We've increased our ability to follow any patient that gets admitted across Ontario to any of our hospitals, and we'll be following up on whether they have any underlying illness, what their vaccination history was. But we are not hoping that as a strategy. We are planning to best protect our health system, even if it's less virulent, because it spreads so quickly. We're anticipating a potential impact on our healthcare system, and as a result, we're doing our utmost to plan and prepare for this increase in transmissibility. I'd be absolutely delighted if the science shows that it's less severe. There are many differences between our populations in South Africa and in Ontario, age being one of them, comorbidities being another, and certainly health system capacity being much different. So we're following England, we're following Denmark, we'll certainly be watching across the United States if they have a rise in cases, and preparing our system to be best resilient to Omicron as possible.
Follow-up?
Yeah, Dr. Moore, you mentioned in response to another question that I guess test to stay will be rolled out for healthcare workers. What about rolling out that policy for other frontline workers, emergency workers, police officers, firefighters? I know there are concerns that there could be a lot of these persons deemed close contacts and then put on the bench for a long time, even if they don't have COVID, and also extending that to the school population. You know, last week there was a high school in Ajax where the whole school was shut down for what's believed to be 3 identified cases in the student body. And I know a lot of parents were rather frustrated. They said, you know, pretty much most of the student body is vaccinated. So, you know, what's going on? Surely there's a better way.
Yeah, no, really good point. We're trying to increase the availability of rapid antigen testing. So my point for healthcare workers, that's if you are identified as a high-risk contact, you would be tested on a daily basis. Otherwise, all immunized or non-immunized workers are getting tested at a minimum of twice a week in the healthcare sector. We should prepare for additional testing for other high-risk essential workers and have been preparing for that. So hence the reason we're trying to procure further rapid antigen tests beyond the 45.8 million that have already been deployed across Ontario, the 11 million that will be put in the hands of parents and students in the next few days, and the 2 million that we're using for pop-up testing in high-risk regions across Ontario. So I think that's an excellent point. We're preparing to make sure that our essential workers are maintaining presenteeism through, number one, getting their third doses if eligible, and secondly, having a backup testing strategy for them as well.
Next question.
Your next question comes from Nicole Lampa with CTV News Kitchener. Please go ahead.
Good afternoon, Dr. Moore. We've had 9 youth sports teams, mainly travel hockey, impacted by COVID cases. 4 of the cases are Omicron, with as many as 500 high-risk contacts. Now, our medical officer of health here in Waterloo Region has asked extracurricular school sports and activities be canceled for the year What discussions have you had with our medical officer of health in regards to this? And would you recommend all youth sports be canceled as a precaution in Waterloo Region and across Ontario?
So I'm sorry, I do have a regional associate chief medical officer of health that would be responsive for the Southwest, and those conversations would have happened at that level. We are aware that sports are a significant risk, and hence the protocols that we wanted in place for immunization and distancing. I think when it comes to children and extracurricular activities, we have to take into consideration their mental, physical, and social well-being and have a proportionate response to the risk. So with Omicron, we're just learning what the effects could be with children. I can understand having a precautionary approach to children, given that we don't know the severity of illness associated with Omicron at present. We are trying to glean from all the international evidence and data to understand the risk of this virus for children. But in an abundance of caution, I could understand them wanting to limit these exposures because they can be very labor intensive to try to investigate and try to limit the spread. And I could understand until we get further scientific clarity on the severity of Omicron that they put this in play. It's not a provincial direction at present, and we'd have to review based on how many outbreaks are occurring in those settings, whether we'd make any provincial recommendations. So it's early days yet, but we'll be taking that back to the team.
Follow up?
Dr. Moore, given that Christmas Eve is 10 days away and cases are growing and we're seeing different public health units issue, different restrictions, this is a time of year when many travel from one region to another. What recommendations will you have to those who have plans to visit loved ones in different parts of the province over the next week or so?
Oh, really good point. So we would like to have consistency in the approach of public health measures across Ontario. We understood under Delta, because there was a significant differential on where Delta was occurring and which communities had already been through a third wave, a second wave, and we knew it was occurring more in areas of our province that had not had a significant previous third wave. With Omicron, that game is changing. This virus will be spreading. It's new to all regions of Ontario. None of us have prior exposure to this new strain, and we see that we'd like to have more of a consistent provincial approach. So we've been meeting with our public health colleagues, our public health measures table, and are bringing recommendations to government to have a more consistent approach across all of Ontario heading into Omicron. So the previous strategy on regional approaches was Delta-driven, and as you know, Omicron is becoming a game changer for all of us, both for our immunization strategy and the public health measures that we'd want to put in play to best protect Ontarians. So I think that's a great question. It's appropriate. And as the Chief Medical Officer of Health, I'd want to have a consistent approach across Ontario.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just picking up on your answer there to Nicole. Are you saying that you're going to be coming out in the coming days with province-wide recommendations geared to Omicron?
Yeah, we're making recommendations to government. Government reviews them, and they would be debated and discussed quite prudently as policy directives. You need to look at both sides of every recommendation, and I do believe there will be a discussion in the coming days about what additional measures we may need, if any, to best protect Ontarians against Omicron. It does appear to be much more transmissible than Delta, much quicker spread, almost with a doubling time of 2 to 3 days. I'm sure you're hearing that from many of the science table analysts and scientists. It is a threat, and we need to urgently understand its severity and potential impact on the health system. But we do want a consistent approach if measures are put in play across Ontario.
Follow up?
So with this spreading so rapidly, a lot of people, I think, will be hoping that you come out with that soon. Can we expect to see that advice this week? And what is your advice to people in the interim? Because people who may be watching this news conference on TV are listening to doctors at hospitals saying they would not go to a restaurant, that they would not go to a Leafs game, and things like that. Or, and some people are wondering about going to the gym where no one's wearing a mask and running hard on a treadmill. So what interim advice do you have for people until you come out with whatever recommendations we're going to see?
So thank you so much, Rob. That's a great question. I am most concerned about those that are very vulnerable to this disease. So if you're older, you're immune suppressed, you're a transplant, you've received a transplant, or undergoing cancer therapy. Now is not the time to have social events. Now is not the time to be going out to mass gatherings. If you need to go out, please limit your exposure to others. Have the pharmacy deliver your medications if possible. Ask a neighbor or a friend to deliver food to you. I would avoid contact with others if you're vulnerable to this virus at present. So anyone susceptible by age or by comorbidity, by underlying illness, please take caution now. For the rest of Ontarians, what's done us well in the last 20 months and kept us as a world leader in being able to control Delta in our communities has been sticking to the basics of good hand hygiene, physical distancing, and wearing an appropriately fitting mask. It's not a chin strap, it's not a nose strap, it's from nose down to chin, properly fitted, 3-ply, and also together limiting total number of social contacts. That will limit the spread. It's done us well in the past. It should do us well in the future at a population level. But clearly, I'm most concerned with those who are the most vulnerable to this virus. You have to decrease your social contacts.
Last question.
Your final question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Dr. Moore. So, again, picking up on Rob's questions, are you stopping short of telling people, the rest of Ontarians, as you refer to them, are you stopping short of saying you need to cancel your Christmas gatherings, holiday gatherings?
No, I think Ontarians have always been prudent, they've been reasonable, and that you should be doing a risk assessment based on your own personal health, your risk of having an adverse event or outcome associated with Omicron, and the vaccination level of the community around you. Most health units are on their website. Will be able to tell you the total number of cases, total percentage that have Omicron, but you can assume that Omicron is becoming the dominant strain in the next coming days or weeks, and take appropriate action based on your personal circumstance, your family circumstance, and the community. I do trust Ontarians to make the right decisions and to limit their total number of contacts as the risk goes up. We will have, I think, further advice coming this week on potential maximum numbers in the gatherings. As you know, the smaller, the better.
Follow up, and this is the last question.
In terms of maximum numbers, a lot of people are particularly looking at the fact that there are hockey games going on, large gatherings of people, many of whom aren't, wearing masks while they're eating things and stuff like that. Are you considering anything in the way of capacity restrictions on very large gatherings?
So, well, great question. We're reviewing all of our policy directions in light of Omicron. But again, they have to be proportionate, they have to be prudent, they have to be reasonable against the risk of Omicron. And that review is being done, has been started as soon as we heard about Omicron, and then will be presented to government for options, and I think further news will be announced later this week.
Thanks, everyone.